Hi, everyone. So I am Shawna Vreeke. I got my PhD studying organic chemistry. I actually studied toxin formations in vaping, and that was a really good transition to working at True Terpenes, where I work now. True Terpenes, it's like an ingredient supplier. We create different blends of terpenes and other volatile organic compounds. And my role is to perform risk assessment on all of the ingredients that we use in our products. So, toxicology is a fundamental science that's in every single industry. It's kind of lacking in cannabis right now, and so I'm hoping to bring it more to the forefront of cannabis. The idea behind toxicology is that every single component that we interact with can cause harm. It just depends on the exposure level, whether it will cause, serious adverse events or negligible or no harm at all. And this is really important when we're remembering, this is the cannabis industry, and a lot of patients and consumers find really great benefits using cannabis. So while there may be a slight risk, the reward of using these products are very, very high. So we need to keep that in mind when we're thinking about what products can be available to consumers and patients. So the background of what is risk, we think about it as a combination between the individual hazard of a material and the exposure level. So for example, we have cyanide and ethanol. And I'm sure we're all aware cyanide is extremely, extremely toxic. It can cause, central nervous damage, lethality, at very low levels. And then we have ethanol, which is the active compound in alcohol. We probably have all been exposed to ethanol this week. Thank you, CannMed. And so the hazard profile of ethanol is a lot safer than the hazard profile of cyanide. Then the second portion of risk is going to be this exposure level. And I'm going to use ethanol as an example. So wine. If you have a glass of wine in a day, you probably won't notice any really risk at all. There are some scientists that suggest a glass of wine may actually even be beneficial. So I can have a glass of wine at dinner. I'll feel really mild to no effects at all. Wake up the next day totally fine. So that risk profile is pretty low. Then let's say, tonight is the end of CannMed. I'm really excited. I have a whole bottle of wine. And so the risk is going to be a little bit higher. Maybe with a bottle of wine, I lose a little bit of ability of my central nervous system, right? I'm not walking so straight. Maybe I think I'm funnier than I am. And I say something and then in the morning I go, ooh, that's a little cringy. And then I'll probably wake up very dehydrated, but ultimately I'll have a good breakfast and I'll be fine. So again, the risk is a little bit higher with a bottle of wine, but still decently minimal. Now let's say someone gets really adventurous and decides to try to drink a barrel of wine in a day. I don't think that person would see the next day. Again, that's a very high risk profile with that large of an exposure. So it's very important to factor all of these things in. So the idea behind assessing risk is not to completely remove exposure. And again, this is super important in cannabis because patients and consumers find a lot of benefits with these products. So we still want them to be able to access it, but at an exposure that is low so that we don't see any risk. Another thing to keep in mind when we're talking about cannabis products is what exposure route is the consumer using. This talk is going to focus specifically on inhalation route because that is a much higher hazard than taking something orally. That's because when you take something orally, it goes through first pass metabolism, which actually changes that compound into something safer typically before it gets circulated throughout the body. But when you inhale something, it goes directly from your lungs into your bloodstream and travels around the body. And also your lungs are a much more sensitive organ than, say, your stomach is. Okay, so why am I talking about inhalation products? Why am I talking about exogenous ingredients, right? That was in the title. That's a really long word. So really what I'm talking about when I'm saying exogenous ingredients are going to be diluents or like terpene additives. These are very common products that are being added into inhalable cannabis materials, specifically vapes. So vapes are the second largest category. Clearly, consumers and patients find really great benefits with vapes. Utilizing exogenous terpene blends can also be really beneficial. It's more economically feasible, and you can have consistency, which is super important, I imagine, for a lot of people here at CannMed, because something with medicine is you want a consistent experience every time, year after year. So by utilizing these exogenous terpene blends, we can control the composition, harvest after harvest, year after year, product after product. So it's a really valuable ingredient to be using in your cannabis vapes. The downside with that is this manufacturers can add really whatever they want into the extract, and the consumer or patient can't visually see that things have been added to it. And so that's why I'm here to bring Toxicology, so that there is a review of these ingredients before they get added into these products to ensure, or at least support, that it's not going to cause harm to our end consumer. Another thing to keep in mind, that the regulations around these products are super varied, state by state, country by country. There is no consistent regulation, and the regulations aren't really that helpful to the operator. So for example, sometimes there's no regulations at all, which is bad. Then a manufacturer can throw, right, whatever they want into these products. Oftentimes regulations use really broad language, like broad umbrella terms that don't actually protect the health of the end consumer or have unintended consequences. And a lot of times these regulations are based on fear of these materials and not actually based on science. So a really common misconception that we see is that if it's a natural terpene, then it's going to be fine. So you can use natural terpenes. But I mean, how many of us can list off 10 natural products that we know are extremely toxic? I mean, cyanide is natural, and I mentioned that earlier. And so, yeah, so I've created tools, and we'll get to that later, for regulators to help them regulate these products. But in the meantime, it's really up to the manufacturers to do the due diligence and be proactive about what ingredients they're using in these materials. And ultimately, these ingredients can cause serious adverse effects. We've seen acute effects, which, really short onset of effects. But we're also concerned about long-term effects. I'm sure everyone here wants to see a healthy, long, successful cannabis industry, which means we need to be making products for consumers that they can use long-term. So we have to think about it now and not wait for these serious adverse effects to show up 20 to 30 years from now. Okay. Some of you may be thinking that, oh, well, there's a lot of other things in vapes that can cause harm. Shawna, why are you so focused on terpenes only? And while that is true, there are other aspects of vapes that can cause harm, such as pesticides, heavy metals, residual solvents. The actual device could overheat the product and that can cause degradation. That's absolutely true. However, most of those things already have a regulatory framework. Heavy metals, pesticides, residual solvents have a regulatory framework where the individual components have unique action limits and it's required to be tested for all those components. So that's why I harp on terpenes, because we don't have that yet. So again, it's really up to the manufacturer to try to understand what is safe to add into their extract. Okay, so I started adding this like fun little exercise into my presentations of like, if we do toxicology, like would this have helped some of the issues that we've already seen? And the answer is yes. Okay, so I'm sure we're all familiar with vitamin E acetate. We know what happened in 2019. It was absolutely terrible. So if there was a toxicologist that had done a risk assessment on vitamin E acetate ahead of time, the question is, would they have advised the company to not use vitamin E acetate? And the answer is yes. There's a ton of research that all came out before 2019 that suggested inhaling vitamin E acetate may not be safe for human lungs. Another aspect of vitamin E acetate is like the degradation pathway, in that when it heats up, it releases ketene, and ketene is an acute toxin, and that is actually one of the proposed mechanisms related to EVOLI. Also, I know some companies that were using vitamin E acetate tried to support the use by saying, oh, well, vitamin E is like good for the body. But there are actually a lot of studies that compared the benefits of vitamin E to vitamin E acetate, and they did not see the same benefits with vitamin E acetate. So again, molecules are different. They're not going to have the same effect always. And then vitamin E acetate has a strong affinity for the lungs, and it does not metabolize the same way that vitamin E does. So potentially it was just collecting in the lungs, and that may have caused this like lipid pneumonia-like effect that we also saw in patients in 2019. So yeah, vitamin E would not have come on the market if toxicology was implemented from the start. Another example, MCT oil. MCT oil has been used and I believe may still be used in cannabis vapes as a diluent. And again, if you do a proactive toxicological risk assessment, the data will suggest that this should not be inhaled by humans. It is a long chain oil, which has caused lipid pneumonia. So MCT can be, suggested to also cause lipid pneumonia. Preliminary research shows that inhaling MCT affected the lung surfactant. So that's going to prevent you from being able to expand and contract the lungs naturally. And then there's this really interesting research, the last bullet point, that I found doing this little exercise that had humans. It was a human study, and the humans were just like laying in the bed. Nothing changed at all, but they did an IV infusion of MCT. That's all that changed, and their oxygen consumption and their minute ventilation changed. So the only thing that changed was an IV infusion of MCT. And so what do you think is happening if you have MCT directly into the lungs? I would assume that would also affect oxygen consumption and minute ventilation, which you don't really want to be changing those things if you're just living your life. Okay, so at True Terpenes, like I said, I created the toxicological program there. And so I reviewed all of the ingredients in our products and other ingredients Our product development team comes to me all the time with like new ingredients they want to use. And I review all those. So I've probably reviewed almost like 200 compounds right now. And part of that review is assigning acceptable use limits. And some ingredients have no acceptable use limits. And that's because the data is suggesting, severe toxicity or specific lung toxicity at very, very low levels. And if we use it at those very, very low levels, right? Because like some amount of exposure is probably fine for anything, but it was such a low level that it wasn't imparting any aroma or any flavor. And so it doesn't make sense to use it in these products if it's not going to impart any sort of aroma at all. So what we wanted to understand was, what does the rest of the industry look like? How do we line up with other terpene blend companies? So we decided to collect a bunch, like dozens of competitor terpene blends, and we analyzed them in-house, and we only looked at compounds that we've assigned no acceptable usage limits. And that's because our in-house analysis is only semi-quantitative. So the ones that have no limit at all, if we identified them, then they would fail our toxicological program. So that's why we chose that list of compounds. What we did end up doing is supporting our internal analysis by sending these blends that did fail out to 2 different third-party labs to verify that that compound was in there. And drum roll, please. 40% of the products that we collected would fail our toxicological program. I will say we only tested products that used botanical terpenes because I always like to say I'm not here to police the plant. So we did not test any like hemp-derived or cannabis-derived terpenes, even though you do still have to be concerned about how much of those you put in your extract, right? Too much terpenes, any terpene is going to be irritating to the consumer. But we were really looking on these specific ingredients that are only going to be found in botanical blends. So 40% of botanical terpene competitor blends failed. Okay, and then we're going to go over some of these problematic compounds. So the first one is benzaldehyde. Benzaldehyde imparts a cherry flavor. It's very well known to degrade by heat or light to benzene, and benzene is a known human carcinogen. Benzene is on the residual solvent action limit, and it has one of the most restricted action limits in the cannabis industry. So it's really concerning that we could have, significant levels of benzene being formed. Sometimes we see it being formed just sitting in the bottle before we even put it in the extract and then heat it up. So True Terpenes, we decided let's be extra cautious and just not use benzaldehyde at all. In addition to its degradation pathway, benzaldehyde has also been shown in research to cause irritation and toxicity in animal models. Okay, the next compound is maltol and ethyl maltol. These are very similar to each other, so I saw like very similar toxicities when I was researching them. This creates like a sweet, sugary note. And they are correlated with high levels of toxicity. Maltol and ethyl maltol are used often in nicotine vapes, so there is a lot of inhalation research. I will say nicotine vaping is not directly correlated with cannabinoid vaping, but a lot of the research is still done on like pulmonary cell lines, and that can be applied since they're both being inhaled. So the graph on like the top right that says E, that was from a paper that tested 12 different flavor compounds along lung cell lines, and ethyl maltol was 10 times more toxic than any of the other flavors tested. So that was really concerning to me. And then the bottom graph tested a few different compounds, including I think it was Maltol, and it compared it to diacetyl, which we all know is popcorn lung, right? And it tested on pulmonary cell lines again, and in some of the pulmonary cell lines, Maltol was more toxic than diacetyl. So that's very concerning to me. So I would suggest not to use these compounds in your vapes. Okay, the last one I'm going to go over is Cinnamaldehyde. Cinnamaldehyde is really interesting because it is a really common flavor, again, in nicotine vapes. And so a lot of nicotine vaping studies have like a cinnamon flavored vapes. And every single time, I'm not exaggerating, every single time cinnamon flavor is tested, it is always the most toxic, like significantly more toxic than any other flavor of any vape. So it's like, why risk it? It's also shown to be like positive for mutagenicity and cytotoxicity in pulmonary cell lines. There's also a case study where workers in a cinnamon processing facility plant, and cinnamaldehyde is the highest composition of compound found in cinnamon. And over 60% of these workers reported significantly serious adverse events just from working around this cinnamon. And then the bottom graph is, or the bottom three graphs are testing PGVG and then cinnamaldehyde along different pulmonary cell lines. And it might be hard to see, but every single time the cinnamaldehyde, even at the lowest dose, was statistically significantly more toxic than PGVG alone to the lungs. So again, we like to err on the side of caution and not use cinnamaldehyde. For all of the compounds that I've mentioned, my product development team has been able to find alternative compounds that impart the same aroma and taste, but have a much higher safety profile. So there is a way to still provide consumers with the flavors that they want. Because let's be real, why shouldn't medicine taste good? But they shouldn't have to worry about a high risk. Okay, this is something that there's not really any information on. So this is kind of like a more call to action if anyone in the audience can test this. It's nitrosamine forming compounds. So nitrosamines are extremely toxic. They're really highly restricted in the pharmaceutical space. And we know that secondary and tertiary amines can form nitrosamines, and this does happen with nicotine during smoking. I have not seen any data to see if this will happen during vaping, but it would be interesting because a lot of these flavor compounds do have secondary and tertiary amines. So I think this would be a really interesting area to study, that is vaping a proper like environment for this nitrosamine forming pathway to happen. I don't know. Okay, so I just listed off a bunch of compounds that could be very scary, but how do you know what compounds are not hazardous? And so we've released a few different tools that can be used. This was a peer-reviewed study that was done in collaboration with other toxicologists and a professor on it's a framework of how to perform these toxicological risk assessments specifically for these exogenous ingredients for cannabis vaping. And then this paper, this is open source, totally free, anyone can access it. Then this paper was adopted into 2 ASTM standards. And the first ASTM standard walks you through how to collect all the data and then how to assess which data is the most applicable to your use and your end consumer. And then the second standard walks you through how to perform these toxicological calculations, so that and then you end up with this maximum acceptable usage limit that you can go back to your formulators and say, these are the limits you can use to formulate, or you can compare it to a product that's maybe already created and understand what's the risk profile of this product. Okay, next steps. I would like to stress for anyone that is using terpenes to create blends, or if they're a terpene blend manufacturer, to be more conservative with your formulations while research is still in its infancy. I know everybody here says we need more research. So until that happens, let's be more cautious and more conservative. And maybe we can all agree that we don't need, say, a coffee flavored vape right now, because we just can't find a coffee flavor that has, a high safety profile that we feel confident using. So sorry, no coffee vapes. I would love to see more adoption of this ASTM standard. The standard can be used by regulators to create these like individual action limits, like we see with pesticides and other impurities and contaminants. Or regulators could write in the law that if you are using these like terpene blends, that the manufacturer has to comply with these two ASTM standards. That's really common in all different industries as well. They just require the compliance. And then obviously like more research. And I would like to thank the two-party labs that helped analyze the competitor blends. Thank ASTM for letting me write these standards. Special shout out to Darwin Millard, who really helped shepherd the standard through. Those were my first standards ever, so that was a fun experience. And then the co-authors on my peer-reviewed paper. And I'll take any questions.
Hey, Shawna. Willie McKinney. Got a couple points, maybe a couple questions. Nitrosamines formed during the curing and processing of tobacco. McKinney Specialty Labs measures very complex aerosols and focuses on measuring nitrosamines. I think you had a question for that. Number two, the standards that you talked about, as you know, I had an opportunity to participate in that process as well. And one of the things I encourage people to do, and maybe this is where I was different from the group, is talk with a toxicologist before you try to interpret and apply those standards, which I know you would agree with.
Yeah, in the standard, it does strongly suggest collaborating with a toxicologist. Yeah.
and then lastly, some of the ingredients, having worked for big companies and served a tox role, which is not the most favorable role at companies. Sometimes when you look at an individual ingredient and the hazard profile, you go, no. But then when you test the formulation, you don't see the same results as you would see with the individual ingredient. And so then you have to step back and go, what's more important, the hazard profile of the individual ingredient or the overall test data on the final formulation? Can you comment on that?
Yeah, I mean, if you have the ability to test the final formulation, that's great. I just know research is extremely challenging. There is a big push to use less like animal studies and to do more of these risk assessments and other like in silico testing. And so that's kind of where true terpenes, that's the direction we've gone. We're trying to avoid doing testing in like animal models and such. And again, these mixtures are very complex. And so traditionally you do look at the individual component to create the overall picture. But yeah, if someone has the ability to test, 200-300 terpene blends with every single possible cannabinoid extract matrix, that would be fantastic. Please do that and publish those results. Well, hopefully don't use animals because that's really sad.
This is a great talk, Shawna. I was curious if you have looked at, or like in natural flower, some of the terpenes are being, bred now to be quite potent. Are there any terps in flower that we should be concerned about? Or, we've been using it for hundreds of years. I'm just curious what you think about that.
Yeah, that's a great question. So there is something in toxicology called like a long, safe history of use. And that's what we utilize a lot when we're applying to like cannabis flower. But like you said, breeding is changing a lot, and we're seeing flower that looks very different from even 20 years ago. So, there could be increased harm there. As far as like individual terpenes that maybe have a riskier profile that have been found in cannabis, there are some, but I haven't seen them at concentrations naturally in the cannabis that would be above like the acceptable usage limit that I've calculated. Where it really comes into play is, when you do the extraction, your terpene fraction is usually separated out from your extract. So just be cautious of how much of that terpene extract you put back in. Again, if you go too high of a percentage, you're gonna notice that irritation. And that's those are some small things to look out for, like nasal irritation. Some people say, oh, if I vape high in limonene, I sneeze a lot. That is a hint of irritation. And so you don't want to continue using those products because repeated irritation over a long period of time is going to lead to more serious health effects.
You got me thinking now, because I went to the CHS talk a couple nights ago. I'm curious what you think about CHS and if toxicity plays a role. I'm talking about cannabis hyperemesis syndrome.
Yeah, that's a great question. I don't know. I know like CHS is pretty new. It does seem to be related to THC levels. That would be interesting to study if terpenes could help kind of mediate that a little bit. Because oftentimes when we're seeing flower with very high THC levels, we see lower terpene levels. And if you believe in the entourage effect, which I think you should, there's a lot of data out there. You want that ratio to be a little bit closer than these like high THC percentages that still only have like 2% terpene. So maybe that could be an effect.
Are there any resources for the general consumer to kind of what you just said, like if you're sneezing after vaping, that's a sign of irritation. So are there any resources for consumers to reference so that they can start kind of identifying which products are less irritating to consume?
It's really based on the individual person, right? Like some people are more sensitive to the more citrusy notes, but a lot of people aren't. We don't really focus, or we don't really have a lot of access to consumers to be able to educate consumers at True Terpenes because we're B2B. But I imagine there's a lot of information out there on the internet that they can find out. But yeah, I do know like consumer education is a challenge that I think a lot of people in the cannabis industry find.